Did you know that your dog is trying to tell you about their health every day, but you might be missing these important messages? While we humans can say when something isn't right, our four-legged companions depend completely on us to interpret the silent signals they send us. Small changes in behavior, different attitudes in daily life, and even subtle alterations in how they interact with us can be valuable clues about health problems that are beginning to develop. Today, we're going to explore the 10 most important signs your dog might be giving about their health, signs that often go unnoticed, but can make all the difference for your best friend's well-being. You'll learn to interpret these silent messages and discover when it's time to seek veterinary help, transforming yourself into the best detective of your pet's health. Before we begin, please leave your name and the city you're watching our content from in the comments. Sign 1. Energy and disposition, when fatigue is a warning. The difference between a naturally calmer dog and one that's losing energy due to health problems can be subtle, but it's fundamental to know how to identify it. Healthy dogs have their moments of rest, especially after exercise or during heat. But they maintain interest in activities that normally motivate them, such as walks, play, or even the arrival of visitors. When a dog that has always been active begins to show disinterest in their favorite activities, avoids playing, or prefers to lie down for long periods, this can indicate physical pain, heart problems, or even the onset of an infection. Apathy can also be an early sign of more serious diseases, including liver problems, anemia, or hormonal disorders. It's especially concerning when the change happens quickly, within a matter of days. If your dog doesn't respond to your calls with the same enthusiasm as always, doesn't get up to greet you, or seems disconnected from activities around them, it's advisable to seek veterinary evaluation, especially if these behaviors persist for more than 2 or 3 consecutive days. Sign 2. Changes in appetite and thirst. Changes in eating and hydration habits are frequently the first indicators that something isn't functioning correctly in your dog's organism. An increased appetite might seem positive at first glance, but it can signal problems such as diabetes, hyperthyroidism, or even the use of certain medications. On the other hand, loss of appetite is even more common and can indicate everything from dental problems to serious gastrointestinal issues. Excessive thirst, technically called polydipsia, is particularly concerning and can point to diabetes, kidney problems, liver diseases, or hormonal disorders such as Cushing's syndrome. Observe not only the amount of water your dog drinks, but also the frequency with which they seek the water bowl. If they begin drinking water from unusual sources such as toilets or street puddles, this can indicate an urgent need for hydration that their usual water bowl isn't supplying. Canine metabolism is directly linked to these habits and persistent alterations for more than 48 hours, especially when accompanied by other signs, merit immediate veterinary attention to rule out conditions that can worsen rapidly if not treated. Sign 3. Changes in sleep and rest cycle. Your dog's sleep pattern reveals much about their physical and emotional state. Adult dogs normally sleep between 12 to 14 hours per day, divided between deep sleep and naps, but significant changes in this pattern can indicate health problems. When a dog begins sleeping excessively, especially during hours when they would normally be active, they may be dealing with fever, chronic pain, canine depression, or even side effects from medications. Excessive sleep can also be a body's defense mechanism against infections or inflammations. At the opposite extreme, insomnia and nighttime restlessness frequently indicate physical discomfort, anxiety, or joint pain that intensifies when the dog tries to lie down. Dogs with arthritis, for example, may have difficulty finding a comfortable position to sleep. It's important to differentiate changes related to natural aging, where older dogs tend to sleep more and have more fragmented sleep, from sudden alterations that may indicate health problems. If your dog is having difficulty sleeping, waking frequently during the night, or showing excessive drowsiness during the day suddenly, especially if accompanied by other symptoms, a veterinary evaluation is recommended to investigate possible underlying causes. Sign 4. Social interactions and emotional behavior. Changes in how your dog interacts socially can reveal much about their physical and mental health state. A naturally sociable dog that suddenly becomes withdrawn, hides in corners, or avoids contact with the family may be dealing with pain, discomfort, or even depression. On the other hand, an increase in aggressiveness in a normally docile dog frequently indicates physical pain, especially when aggression occurs when certain parts of the body are touched. Neurological problems can also cause sudden changes in temperament, making friendly dogs become distrustful or fearful. It's particularly important to observe how your dog reacts to situations that were previously pleasurable, such as the arrival of visitors, play with other pets, or even their usual affection moments. Dogs with chronic pain can develop negative associations with activities that once made them happy, avoiding interactions that might cause discomfort. Hormonal changes, urinary tract infections, vision or hearing problems can also significantly affect social behavior. If these alterations persist for more than a week, especially if accompanied by other physical signs, it's essential to seek veterinary guidance to rule out medical conditions that may be causing these behavioral changes. Sign 5. Hygiene and instinctive habits. Your dog's hygiene habits function as a thermometer of their general health. Excessive licking of certain body parts, especially paws, genitals, or wounds, can indicate allergies, infections, skin irritations, or even anxiety. When a dog obsessively licks a specific area, they may be trying to relieve itching, pain, or discomfort, and this constant licking can create secondary wounds that complicate the original problem. Changes in elimination habits are equally important and can signal everything from behavioral problems to serious medical conditions. A dog that has always been clean and suddenly begins urinating inside the house may be dealing with urinary tract infections, kidney problems, diabetes, or even canine dementia in cases of older dogs. Changes in consistency, color, or frequency of feces also provide valuable clues about digestive health. Persistent diarrhea, constipation, or the presence of blood in feces are signs that require immediate attention. Similarly, difficulty urinating, blood in urine, or changes in color can indicate problems that, if not treated quickly, can become medical emergencies. Observing these habits daily allows identifying problems in initial stages, when treatment is more effective and less invasive. Sign 6. Movement and body posture. The way your dog moves and positions themselves offers direct insights into their physical comfort and joint health. Changes in mobility are frequently gradual in chronic problems like arthritis, but can appear suddenly in cases of injuries or acute problems. A dog that begins to hesitate before jumping on the couch, climbing stairs, or getting in the car may be experiencing joint or muscular pain. Morning stiffness, where the dog seems stuck upon waking but improves with movement, is a classic sign of joint problems, especially in older dogs. Tremors also deserve attention as they can indicate everything from cold or anxiety to neurological problems, pain, or medication reactions. Changes in posture, such as constantly keeping the head low, arching the back, or favoring a specific paw, frequently indicate discomfort in specific body areas. Limping can be obvious or subtle, sometimes appearing only after exercise or at the end of the day when the dog is more tired. It's important to observe not only during walks, but also when the dog gets up, lies down, or changes position. Compensatory movements, where the dog alters their natural way of walking to avoid pain, can eventually cause secondary problems in other parts of the body, making early diagnosis and treatment even more important. Sign 7. Vocal communication, barking, crying, and howling. Your dog's vocalization is a direct form of communication that can reveal much about their physical and emotional state. Changes in usual vocal patterns frequently indicate discomfort, pain, or stress. A dog that is normally quiet and suddenly begins whimpering frequently may be trying to communicate pain or discomfort that they cannot relieve alone. Whimpers are particularly revealing because they represent a discomfort vocalization that dogs make instinctively when something isn't right. Excessive barking or at unusual hours can also indicate problems, especially if accompanied by restlessness or agitated behavior. In older dogs, changes in vocalization can signal canine dementia, where the dog may seem confused, bark at nothing, or vocalize during the night for no apparent reason. Hearing problems also alter vocal patterns, causing deaf dogs to bark louder or with different frequency because they can't hear their own sound. Sudden howls or pain vocalizations, especially when the dog is touched or moves in certain ways, are clear signs of physical discomfort that require investigation. The intensity, frequency, and context of these vocalizations are important for understanding whether they represent normal emotional needs or health problem indicators that need to be addressed. Sign 8. Facial expressions and body language. Your dog's face and body are windows to their internal well-being, communicating emotions and physical discomfort through subtle signs that many owners learn to ignore. A constantly sad, glazed, or dull look can indicate chronic pain, depression, or health problems that affect the animal's general state. The position of ears also communicates much about the dog's state. Constantly low or backward ears outside the breed's normal pattern can indicate fear, anxiety, or discomfort. The tail, frequently called the emotional barometer of dogs, offers valuable clues when its position or movement differs from usual. A constantly low tail or between the legs can indicate pain, especially in the back or hip region, or emotional problems like anxiety or depression. General body posture also reveals much. A dog that keeps the body tense, avoids being touched in certain areas, or assumes abnormal positions may be protecting painful parts of the body. Small signs like avoiding eye contact, keeping the head low even during pleasurable activities, or showing reluctance to move freely are frequently ignored by owners, but can be early indicators of problems that, if identified early, can be treated more effectively and with less suffering for the animal. Sign 9. Anxiety, compulsions, and sudden changes. Compulsive behaviors and sudden changes in behavior frequently reflect underlying health problems that go beyond simple behavioral issues. A dog that suddenly begins chewing furniture, digging obsessively, or running in circles may be dealing with anxiety caused by physical discomfort, hormonal imbalances, or even neurological problems. These behaviors can be attempts at self-relief for pain or discomfort that the dog cannot communicate in another way. The differentiation between learned behavior and clinical signs is crucial. Behaviors that appear suddenly, especially in adult dogs with already established behavioral patterns, deserve more attention than gradually developed habits. Compulsions such as excessively licking surfaces, obsessively chasing their own tail, or repetitive behaviors can indicate problems ranging from allergies and skin irritations to chemical imbalances in the brain. Chronic stress, loneliness, or environmental changes can also manifest through compulsive behaviors. But when these behaviors are accompanied by other physical signs, it's important to investigate possible medical causes. Hormonal changes, especially in unneutered dogs, can cause significant behavioral alterations that affect not only behavior, but also the animal's general well-being. Sign 10. Importance of observation and prevention. As an owner, you play the most important role in maintaining your dog's health, that of attentive observer and advocate for their health. No veterinarian can evaluate the subtle changes in your pet's daily behavior better than you who lives with them every day. Developing the habit of conscious observation means paying attention not only when something is obviously wrong, but creating a mental routine of daily check-ins about how your dog is behaving, eating, drinking, sleeping, and interacting. Small changes, when identified early, can be the difference between simple and effective treatment and a condition that becomes complex and expensive to treat. Regular veterinary checkups are fundamental, but daily observation at home is equally important because you're the one who can detect subtle behavioral changes that may not be apparent during a routine consultation. Keeping a mental or even written record of changes you observe can help your veterinarian make more precise diagnoses and develop more effective treatment plans. Prevention will always be more economical and less stressful for both you and your dog than treating advanced problems. And your attentive observation is the first line of defense in maintaining your best friend's health. Love is in the details. Your dog can't say when something isn't right, but is constantly communicating with you through their actions, habits, and behavioral changes. Each sign we explored today represents a form of communication that your pet uses to try to tell you about their well-being. As a responsible owner, you have the unique opportunity to be the translator of this silent language, transforming small observations into preventive care that can make all the difference in your companion's quality and length of life. The responsibility of being an owner goes far beyond providing food, water, and shelter. It involves developing such a deep connection with your dog that you can perceive when something is different, even if it's subtle. This careful attention isn't just an act of love, but also of responsibility toward a being that depends completely on you for their well-being. Observing isn't just affection, it's also care and prevention so that your best friend lives longer and better.